Good morning. Dear symposium hosts, organizers, and attendees. First of all, I would like to express my appreciation for the invitation. It is a great honor to address such a destination audience. Secondly, allow me to report on the results of our using cryopreserved platelets in a civilian perioperative setting. I represent Moscow's Sklifosovsky Research Institute for Emergency Medicine. The world-renowned scientist Yuri Endemikhov worked at our institute in the 20th century. The former is famous for having developed defibrinated cadaveric blood collection and transfusion technology. The latter is the founding father of the world's transplantology. Not only the pioneered heart, lung, and liver transplantation in dogs, but he was also the first to transplant another head onto a dog. You can see this dog in figure. So they used to be at least 22 head dogs, 18 barking and taking walks in our institute parks. Our institute's medical staff both provide emergency care and perform organ transplants, heart and lung, liver and kidney, pancreas and intestine, which necessitates massive transfusion support. That context brought into existence our institutional 24 hours and 7 days on the week transfusion medicine service department and its related cryobank. In addition to plasma and red cells, we raise extensively harvest using the trimmer a cell and store apheresis platelet concentrates. The worldwide demand for platelet concentrates is increasing annually. Thus, we doubled our platelet concentrates preparation and storage from 500 doses in 2011 to 1,000 doses in 2017. You can see it in the figure. We routinely monitor platelet concentrate quality parameters. While the total platelet count exhibits no significant change between 96 and 120 hours, the literature suggests that platelet function decrease after between 72 and 96 hours of storage. To improve the evidence base, we developed and patent and original method for measuring post-storage platelet functional activity by platelet vital staining. This technique enables both platelet morphology and function states to be assessed. These parameters granular-rich platelet count, and platelet adhesion activity. The graph demonstrates decline in platelet function as early as after 72 hours of platelet concentrate storage. These findings are consistent with the literature and determine platelet concentrate clinical effectiveness. A platelet concentrate storage of less than 22 hours permits prophylactic and therapeutic transfusions to be highly clinically effective. Notwithstanding the fact that platelet concentrate are commonly used in medicine, there are a number of drawbacks to their application. Shelf life of 3-5 days at 22 degrees. Quarantine is not feasible. Strategic platelet concentrate reserve cannot be established. The answer to the question, how can require amount of high quality typed antigen typed blood components be readily available in the right place at the right time, goes as follows. Through the use of frozen long-term stored blood components. NATO's blood banks have quite a long history of using frozen blood. Platelet concentrate cryopreservation allows banking autologous long shelf life platelet concentrate, storing HLA and HPA typing allogenic platelet concentrate for long periods of time, extending the shelf time of platelet concentrate from 5 days up to 24 months, transporting cryopreserved platelet concentrates over long distances, additional testing for infectious disease against quarantine, cryopreserved platelet concentrates similar to plasma, providing military and emergency treatment facilities with cryopreserved platelet concentrate, and anticipation of disasters, emergency of mass casualty, incidents during peacekeeping mission and of combat operations. Both in the Russian Federation and at our institute, blood has also been cryopreserved. Moscow's Sklifosovsky Research Institute for Emergency Medicine, Transfusion Medical Department developed, patent and introduced a platelet cryopreservation procedure. This procedure includes any steps, collection platelet concentrate, and then concentrate platelets and DMSO treated platelets, freezing and storage frozen platelets at the bottom of crest type mechanical freezer or nitrogen liquid, and then thawed platelets and dilution with plasma. Automated platelet cryopreservation protocol adopted by Moscow Sklifosovsky Research Institute for Emergency Medicine has its characteristic. Platelet content of standard platelet concentrate must not exceed 1 billion per milliliter, with volume being 200 milliliter. osmolality than 380 millismol per liter, defrosted CPC HP 7, platelet recovery rate of 68% of original population, functionally active platelet recovery rate of 52% of original content, cryopreserved platelet concentrate diluted retains both cells based and plasma coagulation profile. Combined sterile cryoprotectant CRYOPRESERVATION DEX 40 is licensed from clinical use in the Russian Federation. This combined cryoprotector was produced in the USA, but today Germany small amount DMSO 1 gram being used obtains the need for removing a cryoprotectant from thawed cryopreserved platelets. Post-thaw DMSO concentration of 0.4% in cryopreserved concentration is 70-fold lower than the toxic dose of humans. The production and use of cryopreserved platelet concentrate have tripled or quadrupled since 2016. Donors been repeatedly tested for AIDS virus, hepatitis C and B, and syphilis. The CPC are quarantined 180 days after platelet concentrate collection. Over the last 4 years, 22 doses out of 400 have been found infected. You can see this in the figure. The report presents the data of cryopreserved platelet concentrates transfusion in post-op cardiopulmonary bypass surgical patients automatically reinfused age 60 years, body surface area 2 square meter, and intraoperative blood loss 2,000 milliliters and over, and thrombocytopenia, platelet count of 60 billion per liter and below. In all of the patients refracted to cryopreserved platelet concentrate were both rhesus factor and AB0 systems and HPA, human platelet antigen, and human leukocyte antigen matched. The Immucor Neo and CapGP technology we used. Cross-matching makes it possible to identify if there is immunological culprit behind thrombocytopenia. To select a platelet concentrate to be compatible with individual platelet concentrate refractory patients. To determine whether the mother to be has antibodies to human platelet antigen 1A antigen. Effectiveness of cryopreserved platelets concentrate transfusion was appraised clinically and by calculating the correct count increment for platelets, including patient weight and cryopreserved platelet concentrate dose at 1 hour and 24 hours following transfusion. High 24 hours corrected count increments and corrected increments functional active platelets values were demonstrative of high effectiveness and cryopreserved platelet concentrate still circulating in patient's blood. Transfusion of AB0 and rhesus factor systems compatible cryopreserved platelet concentrate reduces number of needed platelets, red cells, plasma transfusions, and halves cost of transfusion therapy. Conclusion. Quarantined cryopreserved platelet concentrate were demonstrated to be highly effective and safe in correcting thrombocytopenia in cardiac surgery patients. The main clinical effect is due to the high performance of cryopreserved platelet concentrates comparable to that of platelet concentrate. The long-term storage of platelet concentrate is in the frozen state allowed tailoring cryopreserved platelet concentrate to be AB0 and rhesus factor and human leukocyte antigen and human platelet antigen compatible with the individual recipients. The function active platelets number being quite large, 100 billion cells per dose, yielded their high effectiveness and enabled and therapeutic dose of platelet concentrate to be halved from 200 billion cells per square meter to 100 billion cells square meter per square meter as based on the patient's anthropometry. The cryopreserved platelet concentrate cross-matching improved the effectiveness of blood component therapy and prolonged the donor platelets survival time. My beloved colleagues, Professor Khvatov and I wish you a strong, favorable tailwind in your future work and research. Because of my being poor at English, especially at understanding American English by ear, I am asking you to allow me to answer any of your questions face-to-face within a more private discussion, so to say. Thank you.
Questions from the audience?
I have a translator.